Welcome, everybody. So we're going to just give folks a few minutes to start getting into the room, and then we'll do a little bit of housekeeping. We're really grateful that everybody could join us today for our July webinar. We are so thrilled to have Dr. Michael Lindsey with us today, and he'll give a bit of a deeper dive into all the incredible work that he does in New York here in just a moment. All right. So it looks like we've got a pretty solid amount of individuals right now. Dr. Lindsey, it looks like we've got about 70, 71 plus individuals. So again, thank you to everybody for joining us today for the Behavioral Alliance of South Carolina's July webinar. We are going to be joined and are joined by Dr. Michael Lindsey, where we're going to be presenting Suffering in Silence, Signs of Suicidal Behavior in Black Youth. A little bit of housekeeping before we get started. Everyone, if you've got any questions, please place them in the chat box, and I'll be sure to field those to Dr. Lindsey as we go through the presentation today. For those of you that may be joining us by phone, you can certainly raise your hand with any questions. And if you'd like to unmute yourself, you can press *6. That way we can have a dynamic conversation. So with all of that being said, we want to say a massive thank you to Dr. Lindsey for being with us today and sharing his vacation with us as well. So I'm going to go ahead and turn it over to you and say thank you and welcome.
Thank you so much, Taylor, and thank you for the folks at the Behavioral Alliance of South Carolina for the invitation. I'm going to just jump right into the talk, and we'll qualify my my initial comments by just saying that this is a very difficult topic to talk about, and so I just want to prepare anyone for any triggering that this subject matter might bring up for you, and hopefully the Behavioral Alliance of South Carolina will share resources for connecting to supports. But if there's anything that I can do, obviously I want to be available for support and assistance related to anything that might be triggered. So I want to begin by, and I'm not sure why my thing is not going here. Okay, yes, here we go. By just introducing you to some young folks. So this is Rylan Ty Hagen, whom I had the opportunity to actually, meet and talk with his mom about, his life. And unfortunately, Rylan died by suicide in 2017 on a day when it was a teacher resource day. He was at home. His mom expected to come back home to prepare dinner and to hear about how that day went for Rylan, but came home to discover Rylan hanging from his bed, having died by suicide. Gabriel Tay was actually 8 years old. Rylan was 11. Gabriel was actually 8 years old, from Cincinnati, Ohio. Again, his mom came home to find him hanging from his bed. Gabriel had been bullied in school, and there's actually video surveillance of Gabriel being accosted by peers in school and left for 8 minutes or so unattended to by any school personnel. A few days later, He returned to school and was bullied again, and then later on that day um, took his life. And Seven Bridges, whose mom I also have met and have talked to about his life, and just trying to understand what the circumstances were that led up to Seven dying by suicide. And his mom told me of Seven being bullied at school as well, but racialized bullying that he endured on the school bus, and in some instances at school. And again, Seven Bridges' mom comes home to discover Seven hanging, having died by suicide. So I wanted to start this conversation by bringing you into the lives of these three young people that I have described here. Seven was 10 years old, I want to say. Rylan, 11. Gabriel Tay, 8 years old. They represent a growing number of kids, Black youth in particular, who are dying by suicide. I first came to this issue a matter of a crisis, I would say, by looking at the study that was produced by Jeff Bridge and colleagues from Nationwide Children's Hospital. And so they looked at death by suicide for 5 to 11 years old kids, and saw that over the span of from 1993 to 2012, that the rates have been increasing for Black youth, while increasing to some degree for white youth, but decreasing over that span of time. And so it's now the case that Black youth are actually dying at 2.5 times the rate of white youth. Again, these are 5 to 11 year old kids. Jeff updated the study, and in 2018 came out with some new findings that it was basically 5 to 12-year-old Black kids had significantly experienced an increase in suicide relative to white kids. Again, 2.5 times higher for Black children compared to white children. And this was a finding observed in both boys and girls from 2001 through 2015. I have been in the space of doing research and not just resting on publishing findings, but really trying to pursue advocacy and policy to address the issues. And I'm going to talk in a few moments about what I think are the reasons why we're seeing these trends. But I want to just bring you a little bit closer to some of the work that I've been doing by telling you about this really powerful experience I had in December of 2019. So sitting in my office before COVID, obviously we were in the office, and I received 2 emails from 2 different parents saying that they had heard of a study I did, or they saw an interview, and wanted to talk to me about a situation that was happening in their kid's school. And I noticed that the 2 different emails came from Detroit, Michigan. And so I set up this call with these 2 parents because I realized that what they were telling me about what was happening in their schools, their children's school, was actually from the same school. So I said, well, let me get them on the phone and see what I can discern about what's happening. And they told me that starting in October of 2019 through about November, late November, early December, that there were two students in their children's school, two Black high school age kids who had, well, one was on life support, but ultimately died. Another young person actually died by suicide. And then there was a graduate of their school who was a sophomore in college who took his life. And so they were really concerned about what was happening with the kids in the school, and obviously concerned about what might happen to their children. And so I then set up a subsequent call with more parents. It was really interesting how these Black parents who actually have kids who attended a private school, a majority white school, were really concerned. These parents were Black. They were concerned about what was happening to Black kids in this school, and just really sobered me around, I studied this issue, trying to do some advocacy, but it like hit me right in the face. Like, this is real. We're talking about families who are really struggling with the circumstance, and just really brought home for me the importance of doing this work. And what I shared with them was that, unfortunately, it is the case that not only are we seeing more and more younger kids die by suicide, but we're actually seeing more and more Black youth who are middle and high school age actually engage in suicide behavior. So I just want to set that piece into context by broadly sharing that what we know about suicide is that between kids between 12 to 18 years old, this is the second leading cause of death. And in 2017, for which that was the latest year for which data was available, over 2,200 kids actually accounted for suicide-related deaths. And over 1,100,000 youth in 2017 were seen in an emergency department for self-harm behavior, right? So obviously we should be talking about this more and more, broadly speaking, for all youth. But I want to point to something that my colleagues and I discovered in a study that was published in Pediatrics, Journal of Pediatrics, in November of 2019. So given the work that Jeff Bridge and colleagues at Nationwide Children's Hospital had completed, I was interested in looking at what we were seeing among high school age youth. And I looked at all of the years for which data were available from the Youth Risk Behavior Survey, which is administered by the Centers for Disease Control. And so I wanted to examine 4 indices of suicide behaviors: thinking about suicide, planning suicide, attempting suicide, and having an injury related to a suicide attempt. And so we looked at all high school age youth: Black, white, Latinx, American Indian, Alaskan Native, etc. And so one of the things that was really interesting, well, 2 things, was that what we found was that 1 in 5 adolescents are actually thinking about suicide, and 1 in 10 actually had a plan. So just broadly speaking, that more and more youth are thinking about suicide or planning suicide. In other words, they're engaging in suicide-related behaviors. So what I wanted to determine, along with my colleagues, was what were the trends over time? And were there any sort of racial and gender-related observations that we might observe and see with respect to these trends? And the major finding was that for every other racial and ethnic group except for Blacks, the rate of suicide attempts actually decreased over that span of time. So, for example, for white kids, the rate decreased by 7%. For Latinx, the rate decreased by 11%. For Asian American, the rate decreased by 56%. For American Indian, Alaskan Native, the rate decreased by 8%. But for Black adolescents, the rate increased by 73% between 1991 and 2017 for suicide attempts. We ran the data a few times just to make sure this was making sense. Like, could this really be the case? And again, 73% increase among Black youth related to a suicide attempt, while all other racial and ethnic groups had a decrease. And I just shared with you what those rates were. So I want to dig a little deeper. And what was interesting is that, this is our a table of the findings. But what we also observed was that Black adolescent boys actually had a linear increase in injury by attempt over that span of time. And that increase was by 122% for Black adolescent boys. And again, both for girls and for boys among Black youth, they both had an increase, a linear increase in terms of suicide attempt rates over that span of time. I should also mention that for thinking about suicide, planning suicide, all racial and ethnic groups saw a decrease over that span of time. And again, when you get to attempts, you see the decrease continuing for all other racial and ethnic groups except for Blacks. And so I'll talk a little bit about why I, observed or thought that we should explore this further with respect to the decrease in terms of thinking about suicide and planning suicide for Black youth, yet there was an increase in attempts for Black youth. But what I think may be happening because this piece about the injury by attempt among Black boys was very interesting. And again, that rate was by 122%, suggesting then that Black adolescent boys might be engaging in more potentially lethal means by which to attempt suicide. And certainly the prevailing research suggests or tells us that this is plausible, right? That they could be engaging in more potentially lethal means. So from 2001 through 2017, 52% of the 560 Black adolescent male suicides were by firearms, as opposed to 34% who died by hanging and suffocation. For Black adolescent females, it's actually inverse, in that the greater percentage of Black adolescent females die by hanging and suffocation, whereas only 21% used firearms over that same period from 2001 through 2017. So obviously, one question begs is then that why do we have, for Black boys, so much access to the means by which to attempt suicide, like firearms, etc. But the other piece to this is that we need to get these kids connected to treatment. And again, in some comments that I'll make in a few moments, I'll talk to you about why that is so challenging for Black youth. So for Black adolescent females, they had not only a statistically significant linear increase, but also a quadratic increase, suggesting then that the speed or the rate in terms of the quadratic increase for Black females are actually fast in terms of suicide attempts. So for example, I used a metaphor that if you have two cars going down the highway at the same time, the car for the Black adolescent females is actually going down the highway faster. So it seems to be the case then that more and more Black adolescent females are engaging in suicide attempts. Now, there could be a number of reasons for that. And remember, for both Black male and female, they were the only groups for which there was an increase in attempts, right? And so it could be that Black adolescent females are more vulnerable to interpersonal stress from things like cyberbullying and social media use. And what we know from social media use studies is that more and more females are using social media relative to boys. Also during that span of time, large-scale epidemiological studies have suggested that between 2007 through 2017, remember the data for our study was from 1991 through 2017, but from 2007 to 2017, that there was increases in sadness and hopelessness for Black adolescent females. But in large part, they could be experiencing a sort of double stigma in terms of being Black and female. So there's their experiences with the intersectional stigma of being female, being Black, and then relative discrimination that might happen to them and might affect their mental health. But we need more research on this, right? So we're investigating and following up on this to determine further what might be happening. But I mentioned that we saw a decrease in thinking about suicide and planning suicide. And so why is there an increase in attempts for Black adolescents? And could it be the case that Black kids are going right to an attempt without endorsing any other precursor psychiatric factors like depression or other suicide-related behavior? So we investigated this, and we have a study under review now, but we looked at this notion of an ideation to action framework, looking at the sort of pathway from thinking about suicide to actually attempting suicide. And what's interesting about this is that we often look at suicide behavior and compare it to non-suicidal youth, right? And we don't look within the group of kids who engage in suicide behaviors to determine how there might be this sort of pathway to more progressively dangerous and harmful behavior. We also know that much of what we know about risk factors for suicide behavior relate to ideation, and not so much the progression to a suicide attempt. What we also know is that most people who experience ideation do not attempt. And so this framework then gives us the opportunity to really explore this progression. So we used data from the YRBS from 2015 and 2017. Remember, this is if you don't know, it's a cross-sectional study that happens every other year, beginning in 1991. The latest year for which data is available is 2017, but the 2019 data is coming out in August. So we looked at kids who had thoughts about suicide, a plan, suicide attempt within the past 12 months. And we had 4 groups. And the group that we were really interested in is the smallest group, thankfully, the group who had attempts without thoughts or plans. But the largest segment of the group were kids who actually had thoughts and plans, and then had thoughts, plans, and attempts. It's about 5,000 kids. Most of the kids were female, mostly white, and mostly between the ages 15 through 17. Again, one of these charts, but I'm going to walk through the interesting findings. So it does seem to be the case that Black youth, relative to white kids, are 3.7 times more likely to have an attempt only relative to white kids who have suicide thoughts only, right? So it does seem to be the case then that Black youth are not thinking about suicide, but actually attempting suicide only. And then we also looked at those who were thinking about suicide and planning suicide versus attempts only. And for those kids who thought about suicide and had planned suicide, right? And so could it be then that there are externalizing behaviors that might be an indication that, you know, kids are troubled in a way that they might be considering engagement in suicide behavior. We need to really dig deeper on this issue and determine what's happening. So I'm going to really share with you in these next few moments a couple things. One, why I think this might be happening, and I'm going to borrow a lot from prior psychiatric research that I've done. And then I'm going to sort of talk to you about something that I really am proud about in terms of not just resting on the findings, but really pursuing advocacy and policy to address this issue. So I'm going to walk through that over the next over the remaining slides. So I'm going to talk about the barriers to treatment, which I think is one factor related to why this might be happening. Looking at everything from stigma to misdiagnosis of mental health issues, which I think tends to happen among youth of color, particularly Black youth.
Dr. Lindsey, can I interject
Yes.
quickly? We've got a couple questions before you move forward.
Oh, great.
Yeah, so we've got one individual who's asking us, do we think that impulse control is significantly diminished because of the ACE factors that impact African-American youth? So the adverse.
Yeah. No, I got you. That's plausible. I can't say definitively that might be the case, but I do think that trauma, historical trauma, contemporary trauma, certainly in this context of sort of protest and unrest, social unrest, racialized trauma could be playing a role, but I don't know. I mean, I think that's a plausible hypothesis that we need to explore. It's something that I am thinking about, and unfortunately have access to some data to address just that point. So that's my thought about that, but it's highly plausible that could be the case. It's a great question.
Thank you so much, Dr. Lindsey.
Is there another one?
Oh, it was a bit of a follow-up and you kind of encompassed it. The direct question was, ADHD is often misdiagnosed in children with adverse childhood experiences and those living in chronic stress environments, correct?
That is correct. Absolutely.
Thank you.
Yeah, great questions. Thank you. So When the Jeff Bridge study came out, I wrote a commentary with my colleague Michael Cunningham and at Tulane and Donica Brown, where we talked about, or again, remember the Jeff Bridge study first documented that this issue was happening among Black boys. And for me, it was really clear. I was obviously surprised that, Black boys were dying at a higher rate. But when I unpacked it, I was not surprised because, there's a lot of toxic masculinity messages that we place upon Black boys in particular. Messages like, boys don't cry, man up, be tough. We often even refer to young Black boys as our little men, right? He's the man of the house, particularly if they're growing up in a single parent family context. And those kinds of messages really don't give Black boys the opportunity to fully express themselves along the range or continuum of emotional expression, right? That, it's actually healthy to cry. It's actually healthy to be vulnerable and to express your vulnerability. But increasingly, young Black boys are not given that opportunity. And certainly, since I wrote this piece in 2017, I've come to understand, and talking to some of my colleagues who work with Black girls, that we give Black girls those same messages. Tough it off, and be strong. I remember some years ago, my great colleague and mentor Mark Weiss. I always give him a shout out whenever I get a chance to talk with you all. Sharing with me that a study he did in Baltimore City some years ago, how it was really tough for the Black adolescents who were sampled to admit to being depressed, and how stigmatizing depression and the related symptoms are for Black youth, right? But what happens then is that Black youth in general tend to externalize their behaviors in ways then that might lead to misinterpretation of symptoms, and don't allow them to be appropriately identified, that they might be struggling with anxiety, depression, trauma. And I'll talk about that in a second, because I think it comes up in a really, really pronounced way. Let me move on. So we also know from large-scale epidemiological studies, and this is from the National Comorbidity Survey, which I think is the most recent large-scale sort of epi study on treatment, that relative to white youth, that Black youth, in terms of lifetime specific disorders, as well as Latinx youth, do not reach treatment for mood disorders. And certainly for Latinx kids, for both mood and anxiety disorders relative to white youth, right? And I've based most of my whole career on looking at why is it that Black youth are not connecting to treatment? What are the challenges related to it, particularly for depression? Also, when you look at setting-specific mental health service use, a study by Jane Costello, again using the National Comorbidity Survey, suggests that relative to white youth, Black youth do not reach mental health specialty care, right? Which would include community and school-based services. So what we do know is that the majority of juvenile detention centers are occupied by Black adolescents, right? Latino adolescents, right? So there's something happening then. If they're not reaching treatment, where are their issues being addressed? So in 2010, this is a study that was published in the Journal of Adolescent Health, using data from Nick Longo, we looked at ninth grade kids in Baltimore City. It was 465, around their social network influences and connections to treatment. What we found was that what was interesting is that half of the sample actually had identified mental health needs. This was totally Black sample of ninth grade kids. Half of the sample had identified mental health needs, and only 20% of those kids actually reached treatment. Oftentimes, the treatment was right in the schools where they were attending, right? But they did not reach treatment, which in large part led me to have a really strong interest in treatment engagement research, to sort of delve into some of the ways that we can engage Black kids and their families in mental health treatment, even in the context of school-based services, right? What we did find is that the kids who were actually connected to treatment reported that they had more positive social network support, namely from their family members. And so there was this interaction effect then of higher reported network influence, family support, and connections to treatment for an internalizing behavioral problem for that was at the elevated level for Black youth. So families do matter and can play a strong role when we engage them as a potential support system for kids when they are connected to treatment. But by and large part, that does not happen, and may be a reason why there's a disconnection from treatment. Also did a study looking at kids who accessed the largest psychiatric emergency service unit in Philadelphia, actually at CHOP, Children's Hospital. And what was interesting is that, I wanted to look at factors that influence how these kids actually arrived at this emergency psychiatric setting. 73% of those kids arrived voluntarily. And their odds of a voluntary arrival increased as their level of impairment decreased, suggesting then that these kids were going to the psychiatric emergency service unit for non-urgent reasons. And I remember a reviewer pushed me to sort of explore what might be happening. And I look at the work of Bernice Pesco-Salido, who's a medical sociologist who looks at social network influences. And she talks about this notion of an illness career, right? So when you look over the span of when the illness first started to when you actually received the treatment, what are the ebbs and flow of network influences? And what I know from my research is that for Black kids in particular, that oftentimes their illness does not, sometimes they cover it up and try to hold it within themselves, as one of my studies documented, or it doesn't come up until it's like explosive, in a sense of drawing the ire of their family members or educators, and then that's when care is often sought, right? Oftentimes, it's not a psychiatric emergency services unit, it's actually an emergency department, or law enforcement might be involved. And so there's this sort of sense then that Black youth and their families wait longer and longer and longer and longer until there's an explosive situation. And that might be the reason why they are going to psychiatric emergency services settings for issues that could have been treated in a community-based or school-based setting. So another factor that I want to talk about real quick is the reality that Black and brown kids are disproportionately disciplined. And so relative to white kids, Black kids are overrepresented in terms of school discipline, boys overrepresented relative to girls, and kids with disabilities overrepresented in terms of school discipline, suspensions and expulsions from schools, right? And so I think that plays a role. I always talk about this one story, I'll say it real quick, about a teenager that I interviewed who was really, really depressed. And when I asked him, what do you do when you're sad and depressed? He said, I want to go and knock somebody's head off because I want them to feel the same pain that I feel, right? And so we're not looking then for the underlying, depression or anxiety, whatever the case. We see that explosive, irritable behavior, and oftentimes that leads to suspension, because we then put a disciplined focus on that manifest behavior. So a colleague of mine at NYU, Lisa Janetian, did this really fascinating study and really concluded that poverty obviously has an impact on kids' behavior, but we don't notice it. And what she found was that there was this uptick of behavioral problems that this one school district reported, and they saw it at the end of the month. And what she found, digging deeper into these kids' lives, was that there was an association with the family running out of food stamps that predicted student expulsions and suspensions. So the spike in these behavioral problems were related to the family running out of SNAP benefits. How often do we engage the kid around those kinds of macro family level issues that might be the underlying reason for their behavior? And again, we're looking at the manifest. So I always tell educators when I have an opportunity to talk with them, and certainly this audience, as we are the kind of vanguard for the well-being of kids, we have to really help them to look underneath the behavior to figure out what might be driving it. It's not always about what we see, but what kids are experiencing in their communities and their families that could be playing a role. So here you have this kid who is poverty impacted, but also impacted by potentially immigration status, family, disruption related to housing instability, all kinds of issues that we just don't pay attention to. And then the other piece that is informative to this whole, understanding of what's happening with Black kids is, I've said this earlier, that there's this really strong pathway from prison, from education to prison. So those kids that we're expelling, that kid that shared with me that he wants to go and knock somebody's head off, he's going to get suspended, expelled from school, right? That becomes a vicious cycle. And, there's some research that suggests that, this sort of implicit bias around how we view the behaviors of Black and brown kids start as early as pre-K. I was a part of a study at NYU with colleagues who were looking at the overuse of suspensions and expulsions in preschool. So it happens very early, and is this pathway from schools to prison. which I think is a major, major issue, right? So I'm going to talk about policy and something that I'm really honored that I have been a part of. So policy level interventions, what we know about is variability in care. We need more evidence-based interventions that are tried and tested in real world circumstances. We need greater recognition of symptoms. And so how can we implement wholesale, large-scale training on the signs and symptoms of mental health issues, as I have here, not just teachers, but all personnel in school, right? We know that there are funding challenges. And so how do we, flexibly and creatively pay for services, particularly in terms of the expanded school mental health model that my colleague and friend Mark Weiss has really, showed us is a potential way. And I know there's all sorts of innovations that Mark has done around that. And so I think that, again, how do we I talked to a principal in New York a couple of weeks ago, and he told me that based on the Thrive initiative that is a part of the First Lady of New York, the mayor's wife, has really invested her energies into mental health programming, in schools and other places, like community-based organizations, whatever the case may be, that this principal told me that you basically using that Thrive pool of resources, he was able to get 7 social workers in the school and immediately saw the graduation rate go from about 66, 67% to about 89% in 1 year, just because the mental health professionals, in this case social workers, were available to provide preventive and intervention programming, right? But how are you going to pay for that is a policy level intervention that we actually considered, and I'll talk about that in a second. And then only about 8 states currently offer social emotional learning standards from pre-K through 12th grade. I'm preaching to the choir, so to speak here. The advantages of social emotional learning and what it can offer for kids, particularly in the middle and high school age, around how to express and share their emotions in pro-social ways. But strikingly, only about 8 states, I think it may have gone up to about 10, offer this from pre-K through 12th grade, policy level intervention. But I think the biggest policy intervention is that every school should have a mental health provider, and not just a provider, but it should be proportionate to the number of students in the school. And painfully, and this pains me, that oftentimes in low resource communities of color, that is not the case. It is not the case. And what we see in those schools are more law enforcement. We should be seeing more behavioral health professionals, right? And maybe if we had the requisite number of behavioral health professionals, there would be no need for law enforcement in our schools. Biggest policy imperative. So this is what I'm excited about, right? About a year and a half ago, I was able to do a briefing on Capitol Hill for Congresswoman Bonnie Watson Coleman. I was urged by my dear colleague, Rose Pierre Louis at McSilver Institute, to share in that moment, in that congressional briefing, the importance of establishing an emergency task force to look at this issue of Black youth suicide. Congresswoman Bonnie Watson Coleman heard us and went to the Congressional Black Caucus and said, we want to establish an emergency task force to look at this issue. Now, the task force launched on April the 30th of 2019. The Congresswoman asked me to lead the working group of professionals to support to support the completion of a report that will be submitted to the Congressional Black Caucus. I asked the Congresswoman, how long do we have? Like from April of 2019 to April of 2020? She said, no, you have till December to get me the report. And I'm thinking in my head, that's like impossible. But with the will and the great support that we had on this working group, we made it happen, right? And my colleagues at the McSilver Institute, we made it happen. And so let me just tell you about the task force real quick. It consisted of 15 Congress members who signed on to be a part of this emergency task force, including as I just watched the funeral of John Lewis. He was a part of the working group of the emergency task force. I'm sorry, that saw the importance. I'm getting emotional right now because I just watched his funeral today, and I just remembered that he was a part of this congressional task force that said we've got to bring greater attention to this issue. So I thank the Congressman member Lewis for his great work, and I thank Congresswoman Bonnie Watson Coleman, who heard our cry and said, let's start this emergency task force, right? And so we produced this report, Ring the Alarm, the Crisis of Black Youth Suicide in America. And that same day that the report was released, the Congresswoman authored and submitted an omnibus bill, right? That included expenditure of resources, that included a request to NIMH to engage more scholarship and research in this area. And you may have noticed that NIMH has already responded. In June, they released a request for proposals on this issue. And they referenced this report. And so there's so much in the omnibus bill. It's called Increasing Equity and Mental Health in America. I may have butchered the name. Forgive me, Congresswoman Bonnie Watson Coleman, but I'm just so thrilled. And then now I'm understanding there is a Senate version of the bill that is trying to bring more resources to this issue, making sure that there's an allocation of resources so that more behavioral health professionals are in schools, making sure that we do more training on the signs and symptoms of mental health issues that may be more nuanced for Black youth, to bring more research and attention to this issue. And so I'm really thrilled that we were able to work with the emergency task force, the 15 members who were involved in this task force, and to produce this report, which is available. If you Google it, the report is available online. We review the literature, we talk about the policy solutions, we give resources in terms of what we know to be plausible solutions, but solutions also, plausible solutions that might be in need of greater research and support in terms of its efficacy and effectiveness. So I'm sorry if I'm getting a little emotional because I just watched John Lewis's funeral today, and he was a part of this work, and it just is so meaningful. And I'll stop there because I can keep going. We released a report in 2019. And also, I should say, that we're doing the same level of work in New York State. So I'm working with the Office of Mental Health. Commissioner Ann Sullivan has established a Black youth suicide work group, and we're looking at policy level intervention as well as other demonstration type of efforts that we can bring greater attention to this issue in New York State. Because what I found is that the New York State data actually, for the YRBS, actually mirrored what we were seeing at the national level. And so was really happy that Senator David Carlucci, Assembly Member Kimberly Jean-Pierre on the Assembly side, both passed versions of a bill to create this work group. I just want to bring attention to a Change in the Narrative podcast that we have, Black Boys and Men, led by Rose Pierre Louis, McSilver COO. If you want to listen to a great podcast talking about everything from the school to prison pipeline, health disparities related to Black men, it's a really great podcast that we produced. So I'll stop for questions.
Let's see, I'm checking out you're getting a lot of thank yous here in the chat boxes. Let's see, we've got one, I guess maybe it's a piece of feedback here. Some more thank yous. Yes, I think the amount of gratitude that we all feel right now is pretty incredible. So we've got ACE factors help if they are addressed. The problem, and Dr. Lindsey, I think that you'll be able to speak to this quite robustly. The problem is that there's resource scarcity, right? People, money, and the fear in this question is that may lend itself to limited plausible solutions to help our youth. So maybe the curiosity here is how do we activate community resources to fill the gaps where we may experience resource scarcity in some of our communities?
Yeah, I think it relates to the work that we've been doing, which is that we can't stop with, as academicians, researchers, even practitioners, we just can't stop at studying these issues. That is going to take policy level solution. We can't just stop at implementing these issues in our one, school or set of schools. We got to think about the opportunities to scale these solutions and interventions. And so I think it's going to really take policy level intervention, and it happens by presenting to our elected officials compelling data. And obviously there has to be a political will and interest in doing something about it, right? So, I just think there's going to take that large scale type of thinking and intervention.
Absolutely. And we're populating with a number of questions here. So we've got, as school mental health professionals go back to support students this school year, what advice do you have to offer for these mental health professionals?
Well, first and foremost, we have to make services accessible to kids. We know that this is going to be an unprecedented time in their lives. It obviously has been heretofore, but I'm talking about going back into schools. Like, they've likely have had, they're likely grieving as related to death. There also is, mounting fear and anxiety. And so we have to have those mental health supports available for kids. And, whether that's through telepsychiatry, let's make sure that it's available because, the kids are going to need it. Their families are going to need it. And so I think if they're available, then they have an opportunity to make a difference.
Absolutely. And then last, but certainly not least, how can school level mental health professionals strengthen their ability to intervene for Black youth?
Well, I had this conversation with you all a few weeks ago about this notion of authentic engagement, and really doing our due diligence to ensure that we are prepared to meet the needs of Black youth, that we might have to have greater appreciation of these nuanced factors that I've talked about, right? And suspend our judgment on families or kids in terms of how they uniquely express their related challenges, and really start from a place of wanting to, be authentic, and our support to kids and families. And so it starts within, and a willingness to shake your foundation a little bit, right? Particularly if your foundation leads you to intervene in ways that are going to be harmful. It's not good, right? So it takes that introspection and a willingness to want to be different, right? To want to be different, and to go about this work and ways that are going to be, culturally and contextually relevant.
Beautifully said, Dr. Lindsey. Thank you. I don't know that. Thank you for your passion. Thank you for an incredibly moving presentation. Um, Thank you for your entire career and expertise and all of the research that you've conducted to speak towards the pain that's happening in our communities and validate for these youth the need for upstream prevention efforts. My hope is that today was, and it seems to be most certainly with everybody still sticking with us, a massive call to action to say, what can we really be doing to communicate to these needs for support with our kids. And we are
Yeah.
at Behavioral Alliance of South Carolina, on behalf of the Southeastern School Behavioral Health community, thank you. I mean, just thank you so much for today and for everything that you do for our kids.
No,
It's
thank you. I mean, I think that a friend of mine, um, said to me that, excellence in scholarship is a prerequisite for social change, right? And I think that the driver to all of this is a burning desire to be excellent in scholarship, right? To challenge the status quo, to dig deeper in terms of the answers to these seemingly um, intractable questions, and applying the best sets of analyses that are going to answer the question, and learning them when you don't know them, learning them so that you can be equipped to be able to be excellent in your approach in terms of addressing these questions and concerns, because the populations that I care about and you all care about, need our greatest and our best that we have to offer. So that fuels my passion and energizes me to do this work, and I hope it does for you all as well.
Now you're moving me to tears on this side, Dr. Lindsey. For those of you that, when Dr. Lindsey was referencing our previous conversation, we were privileged again enough to have Dr. Lindsey contribute to our Working Through It Wednesday. So if y'all were curious, if you're going to be able to see this presentation again, access the slides, 100% yes. So if you navigate to our BASC website, which is www.schoolbehavioralhealth.org/BASC, you'll be able to find this webinar as well as a compendium of other resources that communicate to upstream prevention in your schools and your communities on that website, including Dr. Lindsey's initial Working Through It Wednesday that was equally as incredible as our presentation today. So I really challenge you all and hope that you jump in and take a peek not only at that working through it Wednesday and recap this presentation, but also see what other resources are available to you all. I also want to say for any individuals that are with us on Facebook or here with us on the Zoom today, if you or any of your loved ones are struggling with suicidal thoughts or behaviors or need additional resources, you can always call 1-800-273-8255. That's 1-800-273-8255, which is the National Suicide Prevention Lifeline. Or you can most certainly text HELP to 741-741, which is the crisis text line. Here in South Carolina, we also have a local chapter of the American Foundation for Suicide Prevention, and you can access all of their resources and trainings at www.afsp.org. Please follow us on Facebook. Please connect with Dr. Lindsey on Twitter and follow him there. We will make sure to put all of the resources and connections on our Facebook page, archived on our website. And if you have any questions, comments, or want to engage with the Behavioral Alliance of South Carolina, you can email us at basque@mailbox.sc.edu. I know we've kept y'all a little bit over today. Dr. Lindsey, again, thank you so much for everyone that's joined us today. Thank you so much. And we look forward to seeing everybody. Mountains of gratitude, Dr. Lindsey.
Thank you so much.
All right, and please check out all the thank yous and wonderful comments in the chat.
I will do so.
All right, goodbye, everyone. Have a fantastic
Bye.
evening. Do your self-care. Bye now.
All right.
All right, let's see here. I'm sending out the website and I'm going to stop our recording.